Hello, friends. I want to talk to you about vaccines. I grew up in the 60s, and during that time, uh, it was commonplace for public schools to administer routine vaccines to children growing up. And my parents were very, very supportive of that. My sisters and I were vaccinated at our schools for mumps, measles, rubella, polio, chickenpox. If they had something they could put in a syringe, they would jab it into your arm. And we were okay with that. That was responsible parenting at the time. Preventative medicine. It didn't prevent my sister from getting the mumps, and it didn't prevent me from getting chickenpox. But you do what you do, right? So the past 3 weeks, Douglas and I started out feeling that we had like a seasonal cold. And Douglas took a home COVID test and it came back negative. A few days later, he collapsed in the bathroom, was rushed to the hospital by ambulance, only to have them do a different COVID test and discover that he had COVID 19. And while in the emergency room, and I'm waiting for him, the doctor comes and checks in on me because my cough was so bad he was concerned. And he said that I had COVID too. And the two of us were desperately ill. And we made it through the rest of the week with bed rest and broth and different things. Following week, I made it through the first 3 days, but I was so sick I could not work. Now, Douglas bounced back fairly quickly, even though they didn't give him any medications, any antibiotics, any Tamiflu, anything like that. He did bounce back very quickly. I did not. I started getting worse and worse, and last weekend, I ended up in the emergency room myself. And the concern was that I had pneumonia. It turns out I have bronchitis and COVID. So I've been on antibiotics and anti-nauseas, and I have been so deathly ill. The irony is that I had my annual flu and COVID shots back in December a couple of months ago, and I still got COVID. And Douglas refused his vaccines at the end of last year, and he still got COVID. Vaccines are not just personal and individual, but it's a hit or miss if they're going to work. The hope of medicine, modern medicine, is that some vaccines will prevent you from getting things, wiping out polio and whatnot. However, when it comes to flu shots and COVID shots, because those are ever-evolving viruses, they just hope that the flu and COVID shots will help lessen the distress on your body and get you back on track quicker. So I have always been a pro-vaxxer. And I remember in 2020, my state almost declaring a Nazi-level martial law if you didn't have COVID shots, if you didn't wear your masks. You were supposed to snitch on your neighbors if they had an extra car in the driveway. And they were vaccine. Employers threatening to fire you if you didn't get the shot. Well, there's 2 parts about this in the state of Minnesota. That's shame on state of Minnesota. One is that we have one of the highest Somali populations in the United States, concentrated in Minneapolis and a little bit in St. Paul. And in 2017, and I believe again in 2019, we had 2 very serious measles outbreaks at daycares and elementary schools in the Twin Cities, in the Somali communities, because they do not vaccinate their children against measles. And none of those families were arrested, put into camps. They were not ticketed. They were not reported and snitched on by their neighbors. But if you were a Minnesotan and you didn't get your COVID shot in 2020, it was okay to have a very high, dense population of anti-vaxxers in one place spreading measles among babies. That's okay. But you need to document with your employer and prove that you're having a COVID shot. Well, you know what? HIPAA law prevents your employers from digging into your personal, private medical care anyway. So they're really not even supposed to know that shit. So the violation of the Minnesota citizens, their HIPAA violations that Walz enacted, and the threats and the horror that he made us live through, only to have previous and post-COVID measles outbreaks in the Twin Cities that barely made the news. So when it comes to vaccines, I don't think you can pick and choose your battles. If you're going to vaccinate, vaccinate. If you're not, you don't. If you choose not to vaccinate your children, that's your choice. Nobody is faulting the Somali community for not vaccinating their children against measles. We know the benefit of vaccinations against measles. But in an effort to, be respectful, nobody enforced it. So, pro-crime, pro-disease, that's okay. That's okay. Yeah. So I think in the wake of RFK taking over the Health and Human Services Department, we must understand that, yeah, he may have concerns about vaccines, but those are legitimate concerns, because during his confirmation hearings, it was revealed that the FDA actually does not have the assumed studies, research, and tests on these vaccines that we assumed they did, because we assume when the FDA approves a vaccine that it's already been through all kinds of rigorous testing. Well, guess what? That's not the case. We are giving vaccines to our children and ourselves routinely that have actually no research done. And that's why the FDA and the health department was able to expedite COVID vaccines out there. They felt comfortable in risking the lives of an entire nation because that's been their MO all along. Now, being concerned about vaccines and being an anti-vaxxer are two completely different things. RFK stated under oath that all of his children are vaccinated. He supports anybody that wants to vaccinate their children. He supports anybody that wants vaccines for themselves. But he also supports people that don't want them, and he respects and empathizes with their concerns. We know that vaccines don't cause autism. They don't cause, all this crazy shit to happen. We know that. Get over yourselves. That's stupid to think that. But we do know that vaccines react and respond to a human body uniquely and individually to each and every body, because we are unique individuals. So Douglas doesn't get the COVID vaccine or the flu vaccine, and he gets COVID. He has a real serious 72 hours, but then he bounces back and he's perfectly fine. And me, I get both vaccines, and I've missed almost 6 days of work. So it's kind of ironic, but it happens. And RFK doesn't care if you want vaccines or not. What he cares about is that you are informed about what you are putting in your body and that of your children. And if he has concerns about a vaccine, he's not going to block it. He's going to demand better data. And that's okay. That's what reasonable people do. It's like abortion, or, are you a Democrat or Republican, or, a vegan, or, carnivore, whatever. These are personal, individual human choices that we are allowed to have as human beings that live in a free nation. We're allowed to have these decisions and make these decisions. And we're allowed to make mistakes. And if we get a vaccine and it doesn't work, that may not be a mistake. It just may be that you're an individual. And those vaccines respond differently to each individual. And so your experience moving forward and what you impose upon your children by that experience will occur based on what happens to you. So if you are a child and you get a vaccine and you have a severe reaction to that vaccine, odds are you're going to be very concerned and hesitant to vaccinate yourself and your children moving forward. But if you're someone like me and you go into it realistically, and you understand that the hope of a vaccine is that it will lessen the impact of a virus or a disease, or hopefully eliminate it altogether. It's preventative medicine. It's proactive medicine. So if your neighbor is an anti-vaxxer and you are pro-vaccine, don't judge them. Leave them alone. Let them be. They have reasons for feeling the way that they do. And if you want to continue vaccines, that's great. We don't have to agree on whether vaccines are right or not. But what we do have to do is we have to respect each individual's choice with vaccines. And like pro-choice or pro-life, it's a personal and intimate decision, action upon your own body. And if we're going to fight for women's rights to be able to choose to abort pregnancies, and we have to respect that, and we have to protect those women, and we have to pretend that we understand what they're doing, we have to do the same thing for people when it comes to vaccines. So back off of RFK. He hasn't done anything wrong. He merely wants more data and more facts and more research before we start pumping stuff into our bodies. And if it wasn't for antibiotics and really good cough medicine, I wouldn't be able to be here today to give you this video, because I have been choking to death for days and days. So, I bid you farewell. Do good, be good.